Hello, I'm Dr. Richard Downs, and I want to talk to you about the issue of snoring. But first, I want to upload or show you this YouTube video of a snoring hummingbird. It's really cute.
A scientist in Peru captured this, escaping from the tiny body of a sleeping hummingbird. A high-pitched but unmistakable snore. Hummingbirds are loved for their beauty and speed, but this one was behaving a little bit like a human. The perfect cute response trigger.
Perfect cute response is right. The perfect way to introduce the subject of snoring. My name is Richard Downs. I'm a dentist who treats obstructive sleep apnea and snoring quite frequently in my practice. I also offer an online home sleep study at onlinehomesleepstudy.com. Why would we want to talk about snoring? Snoring is not just a cosmetic or annoying problem of noise that causes problems for you and your sleep partner, but it's also can cause other health problems. Not only can it affect the roof of the mouth, the soft palate, and the throat, but it can also lead to obstructive sleep apnea, which can cause heart disease, stroke, high blood pressure, and many other ailments such as depression. Snoring can cause a number of maladies in your sleep partner too. If they can't sleep, they can also have health issues. Some of them are unable to even sleep to the deep stages of sleep. We know that snoring worsens over time, and snoring is a sign that you should be tested. And here's a picture of a uvula in the back of the throat of one of my patients. You can see that it's elongated from the snoring, and it's gotten flabby. Even the whole soft palate has lost its tone and has no ability to function like it should. You can look at photos of uvulas online. You can go online anywhere. You can see one here that's wide and flabby from snoring. Sometimes the roof of the mouth can get red from the snoring. Talk about women and health problems with snoring. We tend to think that snoring is men, older, overweight men. But in this study by Maureen Solomon on Health Day News, I found this online right here. I'll show it to you. This is her article. And she went to a Chicago conference by these authors, the U.S. National Institute of Neurological Disorders and Stroke, and they came to this conclusion about women and snoring. In both men and women, those with sleep apnea and snoring tended to have larger left ventricles of the heart, meaning the walls of the heart were enlarged and the heart was working harder to pump. But when the snoring group was compared to the unaffected group, a more significant difference was found in the size of the left ventricle among women compared to men. These cardiac changes in self-reported snores suggest earlier heart impairment in women and could point to undiagnosed sleep apnea. So the idea that snoring is not important in women is wrong, and many women suffer from what is called upper airway resistance syndrome, which doesn't necessarily record very well on some sleep studies. Here's another article I found online. You can go to it. It's called Axon and Schwann cell damage. These are the nerve cells in tissue, nerve cells. And you can find that article online, just like I did. Here it is. The authors are down here. Now, in this study, axon degeneration in pre-terminal nerves of the soft palate is associated with pharyngeal dysfunction in snorers and patients with sleep apnea. The most likely cause for their nerve injuries is traumatic snoring vibrations and tissue stretch, leading to swallowing dysfunction and increased risk of upper airway obstruction during sleep. Very significant article. Here's an article relating snoring to chronic bronchitis, and I found this in the January 2008 Journal of the American Medical Association. You can find this online right here. There it is. This is citations here. And in this one, the conclusions of these articles, these authors, is that this prospective study observed that snoring is associated with chronic bronchitis. Our findings provide support for the hypothesis that snoring influences the development of chronic bronchitis. Now, in this article, as I was reading, they did not have a good mechanism, or they couldn't speculate well on the mechanism of why that happens. Their best guess was that the vibrations may cause the inflammation. However, I believe there needs to be a study that checks to see if the aspiration of oral bacteria and nasal discharge bacteria into the lungs by snoring is actually causing the inflammation or even leading to COPD. Now, there's a difference between inspiring and expiring snoring. Some people snore on expiration. It's not as common, but that type of snoring is pretty significant. And this article says that the expiratory snoring predicts obstructive pulmonary disease in patients with sleep disordered breathing. And you can find that article online also. I always like to show those if I can. Now, the good news is the soft palate can heal. In this article found online by these authors that you can see at the bottom of the page, neurotropic factor, BDNF, is upregulated in soft palate muscles of snorers and sleep apnea patients. And that article is right here. And the conclusion of that was BDNF is upregulated in the upper airway muscles of snorers and sleep apnea patients, and especially in patients with swallowing dysfunction. Upregulation of BDNF is suggested to be a response to denervation and reinnervation and repair of injured muscle fibers. Now, reinnervation and denervation is just dealing with, again, with nerves. Our findings propose that damaged upper airway muscles might heal following treatment for snoring and sleep apnea. So if you treat it early, and the earlier you do treat it, the more repair that could take place. Now, I've said before that the vast majority of people who snore have obstructive sleep apnea. You owe it to yourself to have yourself and your loved ones tested for obstructive sleep apnea with our home sleep study. You can do that at onlinehomesleepstudy.com. And here's why. Why would someone order a home sleep study on the internet? Well, one of the reasons is privacy. Many don't want their health insurers or medical records to have a permanent record of their results. Now, if you want to show those results to your MD or your dentist or any healthcare professional that you work with, that's your prerogative. But if you don't want to, our qualified sleep medical doctor is a sleep certified MD, will do the diagnosis and make recommendations, and you'll get a written report. They might even recommend you get a hospital or sleep study done at a clinic or a PSG, those in a hospital or sleep clinic testings done, because yours is not obstructive sleep apnea. Most sleep apnea is obstructive, but there are some that need further testing, and they'll let you know that. Also, the test is low cost. By not using insurance and going directly to the consumer, and with volume, we've dramatically lowered the cost of these studies. I mean, sleep studies in the hospital can cost upwards of $4,000 for some people. We can lower that dramatically, and you'll see that on our site. There's also lowered healthcare costs because many people are being treated for high blood pressure, stroke, and heart ailments and they've never looked at the possibility that they might have obstructive sleep apnea causing these problems. Also, dental care is often affected by obstructive sleep apnea through that night grinding. So by getting this looked at and treated, you can prevent a lot of healthcare costs. Also, there are fewer car accidents, shipping accidents, airline accidents, trucking accidents. If you have a DOT or other type of job that requires a sleep test, we can do this quickly. We can get it to you quickly and the turnaround done for you. Also, there's undiagnosed and unrecognized sleep apnea patients all over this country. Matter of fact, 80% of the 40 million people who are undiagnosed should be diagnosed quickly, and it would lower healthcare costs and suffering for many patients. But that problem is actually getting worse. The undiagnosed population is being bottlenecked by the fact that less sleep apnea patients are able to go to the physician because fewer of them are going into that specialty. And then the last reason is the concern for their sleep partner's rest and health. So thank you for taking a look. If you'd like to know more, go to onlinehomesleepstudy.com. Thank you for taking a look.